So hello everyone, welcome to Singapore. I'm lucky enough to be a guest at the International Medical Clinic here in Singapore, and I have with me Usha Devi, the Group Clinic Manager. And I thought it'd be interesting for everyone to to ask some questions to Usha about how travel health works here in Singapore, because this clinic is one of the ISTM Global Clinic Directory list clinics. So often we might be sending people off to get second and third doses in other parts of the world. So it might be interesting to know a little bit about the services that are provided here. So, hi Devi, how are you doing?
Good, thank you.
Good. Thanks for having us here. And
No worries.
I know I pestered you a bit with some emails to get you to do this,
No
but it's
problem.
really great. So first of all, do you want to just tell us a little bit about yourself and your nursing background and how you came to be working here and how you got into travel health?
I'm a nurse. I'm Singaporean, living in Singapore. I grew up here, studied nursing in Singapore through the Singapore board, and been in nursing for about 27 years now, and been working with IMC for the last 14 and a half years.
Right.
So, and interest in travel health pretty much got picked up together with the interest of moving into this clinic and this practice of family medicine and travel health.
Brilliant.
So it wasn't my subspecialty or anything. I trained with general nursing and just moved on to different specialties, and then interest in different areas.
Okay. Now, I was getting a fantastic tour of the clinic from Kimberly, your colleague, earlier, and it really is a fantastic clinic with excellent services. And she was telling me that it's essentially the first time a traveller sees a practitioner here, it's actually one of the doctors that they will see. Is that right?
Yeah. The practice in the clinics here is different, or basically in Singapore it's different. You touch base with the doctors for most things here. Yeah. Nurse practitioners are not a common thing in Singapore. So what we nurses do, or registered nurses do here in Singapore, is carry out the activities ordered by the doctor. Okay. So a patient or a traveller would come, see the doctor, touch base and get their needs looked at. And subsequently after that, the nurse would be drawing the blood, getting the medication, doing the vaccine and stuff like that.
Okay.
Yeah.
So if they come for a second visit for the next vaccine,
so started a vaccine abroad, say a dose 1 of a hepatitis A, for example. Yeah, they would then come to us. We have to get them to touch base with the doctor first, just to make sure that that's the right timing for the vaccine to be given, and do they need anything else, or have they overlooked anything that they were not given before. Right. So then subsequently, then the nurse would take them into the room and do their vaccines. Okay. And when most times in this touch base with the doctor on the first visit, we tend to also find out about the patient, any his medical histories and stuff like that, where we need to co-manage here. Sure. And look after their health.
And if they were seen here for the first visit with one of your doctors, when they come in for their second visit, then they would just see one of the nurses?
No, they will still see a doctor. They'll still see a doctor each time they come in, unless they have started on a course of vaccine. Say, for example, we started someone on a course of Japanese encephalitis vaccine because they'll be traveling. So we start the first dose after they see the doctor, consult, do that. Subsequently, second dose, when they need to come back, they don't need to touch base with the doctor. They just book an appointment, come and see the nurse. Only because this is all pre-discussed in the schedule, they have been discussed and are comfortable with following.
And the nurses will be following what they see.
Following what the order is. So then we have a system where the doctor has to order up the vaccines before the patient come in. So we go by appointments here. They call, book appointments, so we have a pre-order done by the doctor, going into the notes to make sure it's the right time, right medicine we are going to give, and order that. Then the nurses will administer based on the order.
Okay, right, fantastic. And then the doctors, are they specialists in travel health, or do they do a number of different
Our doctors are all family physicians here.
Okay.
And we have the pediatric division on another unit here also. So they are pediatricians and pediatricians who have practiced abroad as pediatricians, but are family physicians here with us too. They have subspecialties. Some of doctors have done travel medicine. Yeah. Most of them do not have travel medicine because it's a very different specialty abroad. Okay. So they come with general medicine and they pick that up and they attend courses and some seminars and stuff like that, and then bring themselves up to date. So travel medicine is something they pick up in time upon joining us.
Great, okay. And something I'm quite interested in is what kind of, we follow specific kind of guidelines. We have NAFNAC in the UK, which is like a government-led travel health information vaccine service. or sometimes there's other services as well in different parts of the UK.
Yeah.
What kind of guidelines or databases or anything do
The
you follow?
guideline and database, basically, these Singapore Medical Council has various guidelines on how to deal with all sorts of cases, or managing of cases, and travel medicine. They have a general guideline. So what the doctors do is follow that guideline as a general, but we also follow all sorts of different websites, and the doctors are comfortable going onto the CDC website to look at what's recommended. CDC.
Yeah. Okay.
And they also do the Fit for Travel UK website.
Okay, yeah.
So we do quite a bit on that, and it's pretty interesting on that, where you can see the malaria map and show your patients the high risk, low risk, and the no risk on malaria maps there.
Excellent,
and the ISTM websites too.
Right. Okay.
So these are the different links the doctors will go into to check out what is the latest update there, rather than having a book that they open which may not be up to date by the time we open it and it comes into print.
Yeah.
So there's a lot of links they go into there, and the Singapore guidelines is basically they tell you what the generic vaccines are required for Singaporean travellers, but we cater it to our individual patient needs. So our travel vaccines or travel consults, I would say, are very much catered to individual patients.
Yeah. Okay.
They come in, they book with us, say, they call and schedule an appointment. I need travel vaccine updated because I'm traveling to X number of areas. So what we do is, when they come in, upon checking in, they do a questionnaire for us, where they tell us, they pretty much give us some information of the itinerary.
Right.
What kind of travel are they doing? Is it a group travel? Is it a leisure travel? Is it business travel? So we know how to cater to their needs.
Sure.
Accommodations, where they're staying, and what sort of activities are they going to be doing in the travel.
Right.
So then the doctor then brings the patient in, follows that itinerary there, and then caters the travel needs accordingly, the consultation based on the needs on that. So we go through the living of where they're living. So what sorts of food-wise and hygiene and water stuff. And then we talk about activities, if they are going to be doing, or are they going out in the paddy fields, are they cycling through all the paddy fields in Cambodia and stuff like that. So just different activities, knowing then what kind of vaccines would cater for those needs.
Yeah, sure. And how long does the doctor get to do that initial consultation?
Okay, travel consultation lasts between 30 minutes to 45 minutes with the doctor.
Wow.
So in that...
It's longer than probably most of you get, isn't it?
It's, in that time, what they tend to do is cover the base of the itinerary, is basically based on what you're going to be doing. These are the vaccines I would recommend. This is what you have. They go through the patient's vaccination history. So we always say for this visits, bring your vaccination books in. If you have them, the doctor will go through and see what is needed. Most times we do realize that a DTP has not been updated after 10 years or so. A polio hasn't been given in adulthood, only childhood kind of thing. So a typhoid in Asia is highly recommended.
Yeah.
So those kind of things we go through. Sometimes they have in their mindset, oh, I'm traveling here, I only need this particular vaccine because my travel agent said I must get this done. Right. But when they do come to us, we go through and they go, right, this is not updated, that's not done, let's go through this. Sometimes hepatitis A and B vaccines, which is very common everywhere, a lot of patients actually are not aware of their immunity levels or whether they've been exposed or been immunized before. Right. So then we would go, if you don't have histories, we look at immunity levels, we check their bloods for immunity levels to see, and then we start a course. Okay. So it's never too late, even if you're traveling tonight, to see you today and start on something, because we are starting on something today, rather than not doing anything at all.
Yeah. Okay. Yeah. And it's all a private service, isn't it?
Yeah, it's all a private service.
Okay.
And we also cater the needs to anti-malaria tablets and stuff like that too here. So we do all sorts of anti-malaria tablets, the Larium, Malarone, and doxycycline. So we do all that based on their health background and their needs and their compliance to the medication.
Okay. And is it easy enough for someone who, let's say, had started a course in the UK and wanted to complete a course here?
Yeah, it is pretty easy. All the vaccines except for tick-borne encephalitis, which is not available in Singapore, and we don't import that in because it's not a need for it here in Singapore for tick-borne encephalitis. Sure. Other than that, all other vaccines are available. It's just different names from different suppliers. Okay. But if you're talking about the basic Hep A, Hep B, Pyrix, and the MMR, varicella, DTP boosters, we have all that. Okay. All the travel vaccines, typhoid, polio, cholera, We do Japanese encephalitis, so we have two different ones, the single dose and the 2-dose course.
Okay, and the 2-dose course, is that Ixiaro?
Ixiaro and Imojef, so we have both of them.
Okay.
And we also do the meningitis vaccines, all the different meningitis B, meningitis C, ACWY, and all that.
And rabies?
Rabies we do. We have the brand called Rabipure. And so we carry that, and we do a lot of rabies vaccines for travelers in Asia.
Okay, and where do you source your vaccines from? Do you know where they come from?
All our vaccines have to come from drug companies that supply to Singapore, so they must be registered. We can't just go off and buy from abroad anywhere and ship it into Singapore, and they need a HSA regulatory authorization and approval prior to. So the companies that does all that, so that's licensed in Singapore. So we have companies like Sanofi and GlaxoSmithKline that supplies this vaccine, and we order from them.
Great, that's fantastic. And I've been living with a family here in Singapore, and they say that the healthcare system is very, very good here generally. Yeah, they've been
nice to hear that.
Impressed, yeah, very impressed with that. So now you're one of the ISTM, on the global clinic directory list. Do you know how the clinic got onto that list and what kind of vetting system that ISTM used to get on?
What I know is prior to me starting, so this business has been in business in 17 years now. So about 3 years before I joined them, we started off very small, and they did look at different sources of looking at how we can cater to the expat community needs in Singapore. So it was very much catered in that sense, looking at expatriates living in Singapore, how to look after them, how to provide for them for their travel needs. And then the doctors then went on and looked at all the different sites. So that's how we then discovered ISTM, and then got in touch with them and say, how do we go on your link? How do we be up there so that you can use us and we can use your services? So started off very small there. From there we then grew into, and we were at that time with TMVC Australia. On their links too, and using them as a guide and a backup to look at information. So we just all sorts. So
ISTM didn't send someone out to look at the clinic or anything.
ISTM did. Someone did come around from ISTM some time ago, recently, just to have a look and see. And we did speak, and I didn't meet up with her, but I can't remember her name. Yeah,
but that's good to know. I mean, I can see this clinic, and obviously Singapore, good health system, and you know. I can see it's a high quality clinic, but I imagine you might go to some other countries where, the healthcare system isn't as good, and you might be more dubious about. But it's so maybe if I travel elsewhere, I'll have to have a look as well at what the services are like in other places. Fantastic, and we've gone through all the brands and the databases. I've got a couple of questions as well from some people in the Facebook group. So Michelle Sellers was asking. How they're prescribed, whether they use PGDs, which are things called patient group directions we use in the UK. And I think that's kind of been answered because it's mostly doctor-led, so the nurses are then following a prescription for the
following a prescription order by the doctor. So the doctors would go into the notes, look at everything, and then decide from there what exactly is needed for the client, and then pre-order that if someone's coming back for subsequent doses and stuff like that. Even in the sense that someone is coming for travel consult and can't decide whether they would want or not the anti-malaria. But they're not going until a month later, but we've started the vaccines and all that. They're given time to think about it, and if they do decide at the end, they can call up and say, okay, I've decided I want to go ahead with Malarone. So then the doctor just has to order, because that's something they've already pre-discussed. And we also, in travel consults, we recommend our patients various kits that we've done that's specific to us. We give them a medical kit to go with. So it's full of drugs. So we've got something called a gastro kit and a travel kit. So gastro kit basically are medications for gastro problems. So vomiting, diarrhea, for rehydration and stuff like that. Simple little things that if you fall sick, you can open that book, look at your symptoms, match it up in the book, find the drug that's written there, take it accordingly.
And antibiotics?
Yeah, we do some simple antibiotics in there. So it's something where you would prevent you from having to run to a doctor. So we do travel kits.
And do those, out of interest, do those antibiotics that you give for traveller's diarrhea, do they differ depending on which region of the world you're going to, or is it ciprofloxacin?
Yeah, it's ciprofloxacin here, and we use Bexinor too, and Facigen. So we use them, and then in that book we do recommend, say, if this is your symptoms, follow this flow chart. If your symptoms falls in this direction, get this medication. Doesn't get better, move on to this and move on to that. So if someone's stuck out, say for example, in Cambodia, in one of the villages out there, trying to do some voluntary work and fall sick, you just have to open the book, look at the kits, take some medication and get yourself better.
Fantastic. Yeah, excellent. Now we've got a question for Anne MacDonald. She's asking, what do you advise travellers who are planning to visit the UK? So are there any vaccines that you tell people to get if they're going to the UK?
Well, it's usually the other way around. When they come here, they get lots of different vaccines and get all prepared to come and live in Asia and are warned about everything in Asia. When we see our patients who are expatriates living here and they're either being relocated to different countries for work or moving back, we tend to look at all their vaccines and get them updated. There's nothing specifically to be given. Say, for example, like we would say in Asia, in certain areas, you need to do your Japanese encephalitis. In the UK, we don't say for that, but you're looking at what the disease prevalence is. I think like right now, the meningitis, it's on the rise. So we do advise for meningitis vaccines to be updated when they're going back. We do see a lot of teenagers here who are finishing off their schools and going on to a uni back home. So we do uni medicals before we send them off, and they need a medical done. So we tend to do their vaccinations update, and we update all sorts of vaccines like the meningitis, make sure the MMR are up to date, their varicella vaccines are up to date, and then we also look at TB vaccines because of where they're going to be living and what sorts of activities they're going to be involved in. Those are the things we update. So generally, basically, we say if you're going back to the UK, US, get your vaccines updated, make sure you're on top of things. And we also look at not just the vaccines, but also their health in general. If you are a hypertensive patient on cholesterol medication, we make sure you have enough to tie you over until you find your doctor there. So we make sure you get a couple of months supply from here, because we know you'll take time settling in, getting the place organized, everything, before you think about your health. So that will be, we want that to be their first thing on their mind.
And Kimberly was telling me when families come from Australia or the UK, for example, and if they want to stick to the schedules, the childhood schedules that they've been having.
We follow any country schedule. So if a child comes in and say, a mom comes in and I'm living in Australia, I want to follow the Australian schedule, that's fine. We just pull up our Australian schedule, we follow the Australian schedule and go with what's recommended. And generally we update that as and when it gets updated. So about twice a year we do a full check on all the country vaccine schedules and see what has changed, what has updated. So it's summer and Christmas is at these times when we look at all the schedules and update everything.
Fantastic.
So we're up to date with whatever's needed, what's changed, schedules change and time change, and we do that.
Fantastic. Now, Chantel Golding and Karen Rudd were asking what schedule you follow for rabies vaccines pre and post exposure. So I presume it's with Rabipur, it's the same as
it's the same. So Rabipur, we do the three pre-exposure vaccines. So it's 0, 7, 21 or 28 days of the vaccines, and post-exposure for someone who's been vaccinated before, we just continue on and give the post-exposures, which we do. But for someone who's not been pre-vaccinated before, they do need to get the immunoglobulin done as soon as possible. We do not stock that in our clinic. We send it off to the Travellers Clinic in Singapore, which is a government Travellers Clinic, and they have the stocks there that will be seen and be given there.
So they've got immunoglobulin there.
Yes,
they've always got stock.
They've always got stock. So if any one time a patient comes to us post-bite, once rabies, we'll assess the wound and make sure whether you've started immunoglobulin. If they have not, we'll give a rabies shot here, start them on the rabies, send them off there, they get the immunoglobulin done, and then we do the post-exposure. So we follow the CDC guidelines on post-exposure rabies, 4 to 5 doses depending on age and severity.
So I wonder actually in other parts of the region, like if someone's in the middle of Laos or something, and they
will have to know where to go and get immunoglobulin. So for our patients, say if we during a travel consults, we tell them if they decline getting rabies vaccine, we do explain to them, look, if you're bitten, you would have to fly out straight away, go to where they have. So we know Thailand has immunoglobulin, we know Singapore has it. So we give them those informations to update them and where we need to. Sometimes our patients weigh the fact, do I then disrupt my travel, fly out immediately, the cost of flying a person out within a certain number of hours to get that medical treatment, or do I take a pre-exposure vaccine and protect myself and protect and guide them through that travel?
Excellent. I noticed there's been some dengue here, hasn't there? Is that something you've have you seen people with dengue?
It's quite a common thing to say that, but it's quite a common thing in Singapore with dengue.
Yeah.
And there are peaks of times when dengue do happen because of the high seasons here. We do see the cases with dengue. Patients come with mosquito bites. We have test kits in the clinics that we test for dengue test kits.
Okay.
We do their full blood counts and we look after them. So it's a common case or medical situation for us here.
And of course, Zika's been
here too. So we have the testing available for anyone who's concerned about Zika.
Okay.
So far, IMC hasn't seen anyone with active Zika to date, even though there have been clusters in Singapore where we know the cases have been on a high volume number.
Okay.
But it's all under control.
Brilliant. Okay. And kind of wrapping up now, I think, because we'll have to move on.
Sure.
I know you've got work to do. But if someone was going to come from the UK to here and they wanted to get a third dose of rabies vaccine or something, is it best for them to email you first? Or?
Yeah, they could go on our website. There is online registration or appointment request. They could do that and then tell us when they're due for it, and then we can organize the appointment through it. Or if they're in the country, give us a call. We organize. We go by appointments just that we give our patients the service they require and not have them wait for hours in the clinic and delaying with everything else.
Right. Okay. Fine. And it's a fantastic clinic here. Have you got any jobs going?
Yeah, we're always hiring.
Oh, there you go, everyone. So if anyone back home is looking for a job in Singapore, then...
yeah, we're always hiring. We're open for doctors, nurses, support staffs, and staffs. We've got a big team. We've got a team of about 38 doctors, about 40 nurses, and support staff. So we've the reception desk, the back-end work people, and all that.
Brilliant. Well, thank you so much for spending the time to tell us about it. It's really been interesting, and I'm sure everyone back home will be very fascinated and delighted to learn all these facts about the clinic. So thanks very much, and we'll see you all later.
See ya.
Bye.